Good afternoon. So I'm going to talk a little bit about what was some of the topics that I pulled from ASCO presentations this year. These are some of the abstracts that I thought were some of the more interesting ones as they pertain to topics relating to integrative oncology. So I'm going to start off with an acupuncture randomized controlled trial from the MD Anderson. This is a phase 3 randomized trial using sham acupuncture in patients who had chronic radiation-induced xerostomia, or dry mouth, following radiation for head and neck cancers. As a background, there have been several small studies looking at whether acupuncture could be helpful for this indication of dry mouth after radiation therapy. There have even been studies looking at prevention of radiation-induced xerostomia using acupuncture. But there haven't been any large randomized trials looking specifically at a type of control called a sham acupuncture arm. And so the authors set to do this in this study. So they were looking specifically at patients who had chronic radiation-induced xerostomia, who had been suffering with this problem for at least a year following their treatments. They used real acupuncture points in the arm that received acupuncture, both on the ear and then on the body with real needles. And then one of the control groups was a sham acupuncture arm, and this was using points that are not recognized as real acupuncture points, as well as a fake acupuncture needle, sort of like the type of stage knife that you might see where the blade actually retracts back up into the handle of the knife. And so they're able to do this. It was called a Park sham device, which is a well-known sham needle. They randomized to 3 separate arms. The first arm was a standard oral hygiene arm, and then they used 2 other arms. One was a standard oral hygiene plus true acupuncture, which was given twice a week for 4 weeks. And then the third arm was standard oral hygiene plus sham acupuncture, also given twice a week for 4 weeks. And these patients were followed then over time. So it was basically a 4-week study. And they looked at various quality of life questionnaires, xerostomia quality of life, and overall quality of life. This was multi-institutional, so it was conducted across the United States. 258 patients were enrolled. And what they found was that the true acupuncture arm had significant reduction in xerostomia in comparison to both sham and weightless control, which was just the usual care arm, at weeks 4 and weeks 8. By the time it got to 12 weeks, the sham arm actually overlapped with the real acupuncture arm. In terms of overall quality of life, however, you can see this was the top graph shows the true acupuncture arm, where overall quality of life continued to improve even after the cessation of the acupuncture of 4 weeks. It continued to be superior to the sham arm and the weightless control arm 4 weeks, 8 weeks, and 12 weeks later. So in summary, the authors felt that true acupuncture was more effective in treating chronic radiation-induced xerostomia than either the sham acupuncture or the standard oral hygiene, and there were no adverse effects relating to the treatment. The next study, also an acupuncture study, looked at the use of acupuncture for endocrine therapy-related hot flashes in women who are undergoing endocrine therapy for adjuvant treatment of their breast cancer. We know that hot flashes are a common problem in this patient population, affecting 50 to 80% of the patients who are receiving endocrine therapies. Clearly a negative quality of life variable in this population, and many patients stop using their endocrine therapies after they start suffering from this very annoying side effect, which of course can lead to worse cancer outcomes. This was actually 3 randomized trials. They were conducted in the United States, China, and South Korea. All the patients had stage 0 through 3 breast cancer. Of course, all were undergoing endocrine therapies, and they had to have at least 14 hot flashes per week. The intervention arm, the acupuncture arm, was acupuncture given twice a week, this time for 10 weeks. And the usual care arm also continued on for 10 weeks, no acupuncture. They looked at multiple quality of life questionnaires, specifically looking at acupuncture, trying to help with endocrine therapy-related quality of life, overall quality of life, and hot flash scores. They pooled the analysis from the 3 different studies together. They had 158 patients enrolled in this study, and the average was about 6 to 7 hot flashes per day in both arms of the study. And what they found was a statistically meaningful benefit in both overall quality of life, about 8%, and in the hot flash associated quality of life in 10%, but very meaningfully in the quality of life scale called the daily hot flash score, which improved 53% versus the control group of 17%. So acupuncture led to statistically significant improvements in hot flashes, endocrine symptoms, and quality of life in this patient population. The next study was looking at the use of oral minoxidil for patients who had what's called late alopecia. Late alopecia is defined as incomplete hair regrowth greater than or equal to 6 months following the completion of cytotoxic therapies or after the initiation of endocrine therapy. People will lose their hair, and this is a pretty common problem. About 25 to 30% of cancer survivors deal with chronic alopecia or long-term alopecia. The FDA has authorized minoxidil as a therapy for high blood pressure and off-label use. It's been used, as many of us know, for hair growth. Minoxidil stimulates the ATP-sensitive potassium channels, resulting in vasodilation and premature entry of resting hair follicles into the growth phase. That's the mechanism of action. The patients were given a dose of 1.25 milligrams of oral minoxidil daily. The average length of time that they were on this was about 90 days. And the investigators took photos of the scalp using just regular digital photos, as well as a different type of technology that can actually count the number of hair follicles and the density of the hair shafts. They did this at baseline and then at follow-up about 3 months later. And what they found was about a 20% increase in hair density and follicle density in these patients 3 months after initiation, which was pretty significant. So in conclusion, oral minoxidil at this low dose of 1.25 milligrams may benefit late alopecia in cancer survivors, but a prospective randomized trial really needs to be done in order to prove these results and allow us to use this with more authority in a clinic. The next study looked at vitamin D levels as a potential risk factor for chemotherapy-induced peripheral neuropathy. This was a study particularly looking at the SWOG 0221 study, which was a phase 3 study looking at early breast cancer patients receiving adjuvant paclitaxel chemotherapy. And in this patient population, they had baseline levels of vitamin D that were taken as part of the regular study. The investigators from this particular study were looking at vitamin D because they know that vitamin D in a number of other studies has been shown to potentially correlate with chemotherapy-induced peripheral neuropathy, as well as other comorbid conditions and other medical problems such as diabetes. Vitamin D, in terms of mechanism of action of how it might work for preventing chemotherapy-induced peripheral neuropathy, is that it increases the synthesis of neuronal growth factor, or NGF, and stimulates axon regeneration and myelination in animal models. So they define vitamin D insufficiency in this study as less than or equal to 20 nanograms per ml. Most of the labs we know define it as less than 30, but this was less than 20. And they were specifically looking at grade 3 chemotherapy-induced peripheral neuropathy. What they found, with just looking at the patient populations, was they were specifically looking also at some disparity data, specifically between black and white patients. They found almost double the risk of developing chemotherapy-induced peripheral neuropathy in the black patients in this study in comparison to the white population. and there was almost a threefold increase in vitamin D insufficiency levels in the Black patient population as well. Interestingly, the Black patient population also didn't use as much supplemental vitamin D as in the white population. So what did they find? In the overall population in this study, 16% of the patients in the about 1,200 patients in this SWOG study had chemotherapy-induced peripheral neuropathy that met the grade 3 or higher toxicity level, and 33% of the entire patient population had low levels of vitamin D. As it pertains now, however, to potentially vitamin D insufficiency as a risk factor for future development of CIPN, chemotherapy-induced peripheral neuropathy, there was an odds ratio of 1.57 that was highly statistically significant for low vitamin D, ultimately relating to CIPN. In terms of multivariate analysis, that was 1.39 with a trend p-value of 0.066. So this study justifies future studies looking at validating this data and whether or not on a prospective study we can look to see whether supplementation with vitamin D may reduce the risk of developing future CIPN in our patients. This study looked at the potential benefit of circuit interval-based training on insulin resistance and adiponectin among minority cancer survivors. We well know that minority cancer patients and survivors often have worse cardiometabolic factors, variables, including insulin resistance. They tend to be more sedentary, not exercise as much, and there's plenty of data that look at the mechanisms for this in terms of potentially leading to worse cancer outcomes and certainly worse other health outcomes, but not as much in the minority population. So this study looked specifically at minority cancer patients. These were cancer survivors, rather. These were individuals who identified as either Hispanic or Black. They were overweight or obese. They were sedentary. They were specifically breast, prostate, or colorectal cancer patients. There was 30 patients that were randomized to the exercise arm, and then there was a control group arm with just usual care. There was only 10 patients. This was a relatively small study. And the actual intervention itself was 3 times a week of moderate to vigorous intensity aerobic activity combined with resistance training. This was done over a 4-month period of time. The investigators had a very good compliance of about 90% of patients completing the study as it was intended. And what they found, really not surprisingly, was 39% lower insulin resistance scores based on the HOMA-IR lab testing versus the control. There was a 31% reduction in insulin resistance from baseline. There was a 70% higher adiponectin level scores. Adiponectin is a measure of insulin sensitivity in comparison to control, and a 41% higher adiponectin from baseline. This is a really interesting study. This was looking at a patient population in cancer patients and cancer survivors who suffer from major depressive disorder. This was in a single cancer center in Maryland, and this was a phase 2 trial looking at the use of psilocybin, a single dose of psilocybin administered in a group setting. They broke down 30 patients into different groups. They did an individual preparation session with these patients. They then gave them the psilocybin in their groups and then did a group integration session afterwards. And what they were looking at was side effects, toxicity, and potential efficacy for scores of major depressive disorder. There was no attrition. All 30 patients enrolled and completed the study. The main side effect for the patients was a headache in 80% of patients after taking psilocybin. And 80% of the patients, when followed out to 8 weeks, had significant reduction in major depressive disorder scores. And very interestingly, 50% of the patients had a complete remission of major depression by 8 weeks. So it's a relatively short time follow-up. But this is very promising considering the SSRIs have about a 30% complete remission rate in comparison. So 30% versus a 50%. Again, longer-term data will need to be assessed, and the authors plan to do this. So very exciting to see this. We see a lot of data coming out on psychedelic psychotherapy for a variety of disease indications, and this might be one of them. Hopefully we'll see in the future. Medical cannabinoids are commonly used in our patients, and this was the Minnesota Medical Cannabis Program survey looking at what symptoms patients were using medical cannabinoids for, as well as how well they felt that they might have improved these symptoms, and then looking at financial toxicity and the implications of that for the use of cannabis. The median age of the 225 patients that were surveyed was 62 years of age. 52% were female, 71% married, 95% white, 40% retired. The most common cancer in the population that was tested or that was surveyed was breast cancer at 24%, and nearly 50% of these patients in this survey had stage 4 cancers. 75% of the patients reported using cannabis daily, and oral products were preferred over vaporized products. They didn't use whole plant cannabis in Minnesota. The oral products that they preferred using were tablets, oral solutions, and tinctures, and that was preferred over the vaporized products, 80 to 45%. What they found when looking at the patients in terms of what they felt was being improved in terms of their side effects. 83% felt that their insomnia got better. Another 83% felt pain got better. 73% felt stress, anxiety, and depression were improved. 58% had improvements in anorexia. 50% had improvements in other digestive symptoms like nausea, vomiting, diarrhea, and constipation. And almost about 30% had improvements in fatigue. Looking at the financial toxicity components, they found that about 31% of all of the respondents were spending over $200 a month in cannabis products. They then compared patients who were of a category where they called them living comfortably versus those who are finding it difficult getting by. And what they found was those who were finding it difficult getting by had a higher rate of cannabis cessation, 54 versus 32%. They had a higher percentage of this patient population also that was spending more than $200 a month, 43% versus 22%. They had a higher percentage of patients stopping cannabis due to the high cost and because also health insurance did not cover. We all know that stress does play a major impact in many chronic diseases. The question that the authors from this particular study were looking at was whether or not a pre-existing major stressful life event might have some potential interaction as being a risk factor for future development of head and neck cancer or pancreatic cancer. This was a matched case control study of patients who had been diagnosed with one of those two types of cancers in the prior 12 months versus a patient population with no cancer, and this was matched by age and smoking status. They had 77 patients who had either had head and neck cancer or pancreatic cancer, and control group had 201 patients. And what they found was patients who had cancer were significantly more likely to report a major stressful life event within the last 5 years prior to their diagnosis in comparison to the control arm, with an odds ratio that was highly significant at 2.59. So this just adds further data in support of the possibility that major stressful life events may be a risk factor, and there's a number of reasons methodologically why this could be, with immune suppression, impacts on patients' lifestyle. People tend to smoke more, not eat as well, not exercise as much when they're stressed. But there are a lot of different physiological variables that we know that also impact on cancer and general health outcomes. University of Florida did a yoga intervention study. This was looking at distress indicators in diverse women with gynecologic, gastrointestinal, and thoracic cancers. This was a 10-week study looking at 60-minute yoga sessions delivered once a week. This comprised of mindfulness meditation, relaxation, and gentle yoga designed to alleviate distress. 123 patients were enrolled into this study, and they found, really not surprisingly based upon lots of other data that have been presented, reduction in total depressive symptoms, particularly in those patients who are greater than 65 years of age, and reduction in somatic symptoms such as pain, fatigue, nausea, etc. Thank you very much, and this is my one disclosure, as you know. And somebody asked a question.
Yes, I can ask it to you, or you can just repeat the question from the podium.
The question came in saying, what is the proposed mechanism of action for acupuncture treatment for hot flashes? We don't know. It's probably relating to the parasympathetic nervous system stimulation, and acupuncture is well known to do that, so probably is related in some manner to that. Any other questions?
Okay, thank you so much.
Thank you.